Angel white piercings. You know the ones up here? I'm going to go through the pros, the cons, advantages, disadvantages. You 5 each of those. Then I'm going to talk about what you should know beforehand, getting the piercing done, healing, jewelry, living with the piercing, and what happens if you say, I'm done with these things, and decide to abandon them. Coming up next on Pros and Cons by Piercer, Season 2, Episode number 86. For those who are new to the channel, welcome to the Body Piercing and Tattooing channel. Hope you're enjoying the videos. Hope you're finding them helpful and useful. But you might not know who I am, especially if it's the first time you clicked on one of our videos. And everybody else just likes hearing this over and over again, don't you? Come on, admit it. My name is DaVo. I am a professional body piercer and have been since 1994. I own and operate the Axiom Body Piercing Studio, located right here in Des Moines, Iowa, inside Skin Kitchen Tattoo. For those that are paying attention, this is episode 86, even though 87 and 88 are already out. Yeah, somehow I totally missed this one. Just skipped right over it. Anyway, so what we're going to be talking about is basically 2 beauty mark piercings, a Madonna or Medusa, or not Medusa, what am I saying? Marilyn and Madonna or Madonna. I never can remember which side's which. Basically, it's 2 beauty mark piercings done on both sides of the upper lip, done usually with a labret stud or stud-style jewelry with something fancy or just a plain ball. Lip piercings have a long history, especially in tribal cultures, indigenous people of Africa in the Americas. The modern version was developed in the 80s. And it's done a lot. And bites are a big part of that whole thing. And, yeah, there's a lot of bites. Now let's move on to the pros, the advantages, the things that make you go, yes, I want them. Starting with number 1, long history of healing. These piercings have a reputation of healing fairly easily. They don't have a lot of problems or drawbacks to them. So yes, you're definitely probably going to be able, if you take care of them properly, be able to heal these out fairly easily. Number 2, symmetry. Everybody wants symmetry. If you're one of those people that likes everything to be in 2s, this is a great piercing for you. Boy, that rhymed. I could have a new hit single, maybe a jingle. Anyway, done on both sides, kind of draws attention to the upper lip and also the structure of the nose. Number 3, it's a quick healer. Yes, usually only taking a couple of months to heal. This is not a piercing that's going to take an extremely long time to heal. We're not talking about years. We're talking about months. Number 4, can be done in stages. This is a piercing. You can either go in and get both of them done in one sitting, or you can get one side done, heal it out, and then do the other side. It's not, and they can be also, you could add it to an existing beauty mark piercing if you want to. So it's not something you have to commit to right away. Number 5 draws attention to the upper lip and nose. If you're really excited about that part of your body and love it, there's a piercings to get because it's going to draw attention to the area. The other thing is that it tends to not be as abrasive to most people as the ones that are the bites that are on the lower lip. I do not know why, but people don't see these as aggressive and kind of out there. Why, I have no idea, but they tend to be a little bit more socially acceptable. Now let's move on to the evil cons. Things that say, no, don't want it. Starting with number 1. Twice the risk of damage. Because you have 2 piercings opposed to just 1 piercing, it doubles up the risk of enamel erosion, gum erosion, and softening of the bones inside your mouth. If done correctly and you wear the correct jewelry in this, that's pretty minimal, but it is always a possibility depending on your anatomy and the placement of the piercings. Number 2, swelling. Yeah, it swells. These will swell, and they're swell when they swell. This will require longer jewelry to start out with. You're going to have a restricted diet to help reduce the swelling. It's not a fun time. It usually lasts about 3 to 5 days, but it is something that is a factor with any oral piercing. Number 3, you're going to have an increased risk of contracting sexually transmitted diseases when doing oral sexual activities, because these are, even after the piercing is healed, since these are hard metal objects through soft tissue, and we tend to be a little rough when we do certain things, there's a possibility of causing a tear, and an exchange of a pathogen from your partner, and then you got something. So it's one of those ones where whatever switching partners, you're going to need to practice safe sex when you do oral sex. Number 4, scarring. Lip piercings and labret-style piercings do tend to produce pretty noticeable scarring that appears to be open long after the piercing is closed. It could take decades for it to completely fade or get to the point where it's not very noticeable on most people. Number 5, can close quickly. This piercing is prone to closing very rapidly, like oral piercings. In some cases, it doesn't matter how long you've had the piercing. In a matter of hours, it's completely closed, and you have to either re-pierce or abandon the whole idea. Now we're moving on to what you should know before getting it done or preparing. Biggest thing I can tell you is, as you're going to the appointment or the day of the appointment, is go out and have a nice meal before you get pierced. You're going to be limited on your diet for a while, especially if you're a lover of spicy foods like me. So go out and have that fantastic meal beforehand, get some Thai food, whatever it takes, complicated foods, and enjoy it. Plus, it's going to help relax you, because we tend to be more relaxed after we've gone for a nice lunch, maybe with a friend. Before you get the piercing done, check with work and school and sports. If you are involved in any activity that involves a dress code of any type, you may not be able to wear these piercings while you're doing said activity. So it's always best to talk to somebody in charge beforehand to make sure it's not going to create an issue. Nothing sucks more than going to practice or what have you, and then finding out that you either have to go home and not participate or take the jewelry out that you love, your new piercings. Next one. This piercing, because it does scar and does appear open, could possibly affect employment in the future. Now, piercings are becoming more and more socially acceptable, and I do believe that these are more acceptable than piercings on the lower lip for whatever reason. However, it can affect employment. You need to understand it, that there are some people out there that still are that conservative about piercings. So take that into account, especially if you plan on getting into an industry that is extremely conservative. Next thing to consider is you need to find a piercer that's experienced, well-knowledge, willing to educate you, gives out a written instructions, jewelry information, goes through the aftercare verbally, goes through a consultation beforehand, is going to address your understands, knows, and is going to address any anatomy issues that you may have. Basically, somebody that knows what the hell they're doing. Do your research, find a piercer that you're comfortable with, and it should be somebody that's very passionate about what they do and happy to answer any questions. In fact, is a little annoyed when you don't ask questions. And your piercer should have experience with these piercings. It shouldn't be a never done that before kind of situation, unless they're supervised by somebody who has done lots of them, like they're an apprentice. This piercing, there's not a lot of angle is very important, but also placement can make these look great, or they can make them look weird. So it's important to find somebody that knows what they're doing. They should educate you on what cross-contamination prevention is going to need to be taken. I'll get into that a little bit later, but that's something they should cover in their consultation. They should also cover in the consultation diet changes, ways of reducing swelling, also downsizing, that you're probably going to have to downsize this jewelry, and explaining why that jewelry is so big before you even get into it. Next thing is, does your piercer provide or sell aftercare product? If they don't, try to buy it ahead of time so that you have it on hand, and that's one less thing you have to worry about on the day of the piercing. Already kind of mentioned this, but downsizing, usually with these, we downsize them roughly about 4 to 6 weeks. Plan ahead on that happening. It will make your life a lot easier. Now let's talk about the piercing experience itself. Piercing, first thing you're going to do is you're going to go through a consultation. We're going to cover many of the things I already talked about as far as what's going to take to heal it, swelling reduction, dietary changes, checking your anatomy, cross-contamination prevention, downsizing, jewelry, etc. Then we're going to, generally what we'll do is we'll pick out some jewelry. Kind of limited on this. With this, we're going to do a flat back labraze with disc on the back or the inside. And then the outside, there's various different threaded ends that you can put on these. I'm a fan of threaded jewelry when it comes to oral piercings. I'm still on the fence with threadless, but there's a lot of options out there depending on how much your piercer stocks. Then you're going to sign a waiver, which is going to cover some important things like your pre-existing medical conditions, any medications you might be on, or anything that may impair their ability to do the piercing. Also may impede either blood clotting or the piercing healing correctly. Be honest on this. If there's something in there and you see it and you're like, oh, yeah, I have that, talk to your piercer about it. If your piercer is unsure about it, don't do the piercing. Talk to your doctor and see what they say before you take the risk. Next, we set up all our equipment, start unwrapping things or pulling things out of autoclaves and setting up everything we need to do the piercing. Then we will disinfect the area, usually with a surgical scrub of some sort. Most common is probably providine iodine, also known as betadine or PVD. Some people will use other ones, but that's kind of the standard. I've been using it for years, and it just works best. Then may have you rinse with an antiseptic mouthwash, preferably alcohol-free. Then mark the piercings. Now, when you are looking at the marks, you want to look at them close up and at arm's length. The reason being is that not many people see you this close, but pretty much everybody in the world sees you from arm's length or further. So make sure that they look even. Understand that your face is not perfectly even. We usually have kind of a crescent moon kind of shape to our face. It's what makes us attractive and unique. And it should look like they're even, but not necessarily measured out as being even. With these, usually we do them with the edge of the nose as a guide as to where they're located inward or outward. If you are fully satisfied with the markings, and I always say it's easier to move a mark than it is to re-pierce, then I will put you in a reclined position. We use a set of Pennington forceps to flatten out the tissue. We inject a needle in and through. Then we remove the forceps. Generally what I'll do is take a guide pin, threaded or threadless, push it through or push the needle out with it, thread on the jewelry, connect it, push the jewelry back through, clamp a set of hemostats, thread on the ball or push the ball in or whatever we're going to be doing, and then stop any bleeding that occurs, and you have a new piercing. Now just repeat again. Afterwards, you might notice a little bit of slight bleeding off and on for a few minutes. These usually, it's one of those ones where they either bleed quite a bit or they don't bleed at all. Not really a heavy bleeder unless we actually accidentally, we hit some magical blood vessel we didn't know was there. Usually have some throbbing, aching, and maybe some warmth in the area for a few minutes after the piercing is done. The piercing will be very sensitive to the touch. Understand that's training you to not touch it. Don't mess with me. I'm at work, is what your body's saying. I'm working here. Leave me alone. Let me do my work. As far as pain on this, I've had mixed results over the years, but I would say on a scale of 1 to 10, 10 being the worst, most people say this is between a 2 and a 4, maybe a 5 in the worst case scenario. It can be kind of an uncomfortable piercing to get done because you have people moving around and doing things inside your mouth. But other than that, very quick, not very painful. Understand that whenever you do pairs of anything, there's usually a slight increase in pain. With the second one, it's not giant leaps. It's kind of just a little bit more uncomfortable than the first. It's kind of like your body's saying, hey, stop doing this. And then the second time, it's like, you need to stop doing this. They're just intensifying it. Healing. Average healing time on these is anywhere from 2 to 4 months, during which time I'm going to suggest cleaning twice daily using a sterile saline solution. Personal favorite, and what I sell here in the studio, is Neomed's Piercing Aftercare. It comes out in a fine mist. That's not always available everywhere in the world, so some things you want to look for. The first thing is that it should be in a pressurized metal can. It should say sterile on it. When you turn it over and look at the back where the ingredients are listed, you should only see purified water of some type, and sodium chloride. Nothing else. There shouldn't be any additives, no food preservatives, chemical names, Red Seas, sea salt, ocean scent, none of that garbage. There's no reason for it to be in there, and usually it's a sign that the solution probably isn't sterile in the first place. Now, how do you do that? The thing with the saline is it comes in various different styles of nozzles. If you have a nozzle that's a fine mist, you just mist the outside on both sides, leave it alone. If it's a type that comes out like a squirt gun, you can try, but it's not going to be fun to squirt that at your face every day, twice, one on each side. Generally with those, I would suggest doing a cold compress. Take a sterile piece of gauze sponge. I like the Johnson & Johnson 2x2s because they don't have as many strands hanging out. It's tighter weave or something. Anyway, saturate to the point it's wet, lay it against the piercing for about 5 minutes or so. If you're just doing the mist, just let it stay on there for about 5 minutes, and that's enough. You can let it air dry. If it's really driving you nuts, you can pat it dry. The other thing I suggest doing is the end of your shower, pull your hair and everything else out of the way and let the water flow over the piercings for about 30 seconds. What we're doing with the saline and what we're doing with the rinsing in the shower is we're removing the lymph discharge that's going to harden and collect on the outside on the jewelry. The reason we want it off there is when the jewelry shifts or moves, it can agitate the piercing, which can lead to problems, and it doesn't feel very good. If you feel like you have an obsessive amount of discharge or it's just not coming off, see your piercer. Have them take a look at it. Don't run to the medicine cabinet and start pulling out everything tipped in cotton or a sharp point and start digging around in there. Let them clean it for you and make sure there's no other issues and maybe give you some hints on getting that off of there. For the inside, I suggest rinsing twice daily with an antiseptic alcohol-free mouthwash, such as Biotene. About 30 seconds twice a day for the first 2 weeks. Some people have found doing warm water rinses with warm water and sea salt helps also kind of take the edge off of things. For about, a couple minutes, swirl around and spit it out. Swelling will last anywhere from 3 to 5 days. Sometimes it doesn't occur until the second or third day. Cut down your intake of tobacco, alcohol, cannabis, hot and spicy foods, things that are extremely warm in temperature, vaping, or anything that may agitate your mouth. If you ingest something and it burns, don't do it. Just don't do it. You also want to stay away from salty foods and drinks. All of those will lead to more swelling. Food-wise, soft food diet's your best option. Things like yogurt, baby food, applesauce, smoothies, cold treats, gently sucking in ice chips. Basically, anything that's cold and easy to get down is your best options. Stay away from complicated foods or foods that are warm. Cold items and staying hydrated will reduce your swelling. If you usually are going to see the worst of the swelling first thing in the morning. So if you get up throughout the night and get a glass of water, that'll help because you're just going to keep you hydrated. Also, sleeping your head elevated above your heart will help reduce the swelling you see first thing in the morning. Limit movement of the jewelry and the piercings. Try not to talk as much or move around your mouth. Do not play with the piercings. I know it's hard, but the more you mess around with that jewelry, the more you move the jewelry around, the more swelling you are going to see, and the longer it's going to take for the piercings to heal. Over-the-counter anti-inflammatories and even CBG oils can help with inflammation. If you've never had problems using these products in the past, it should help a little bit. When in doubt, contact your physician or your general practitioner because they know more about your health than I do, and I can't prescribe things to you. When it comes to CBG oils, I'm planning on doing a full video on these eventually. It'll probably be on Q&A in the kitchen, or it'll be one of these. They have been known to reduce inflammation. You don't want to put it directly on the piercings, though, because we never know exactly how that reaction is going to be. But ingesting it should help just like you would any other anti-inflammatory medication. And when I talk about over-the-counter, what I'm talking about is Tylenol, ibuprofen, and etc. One thing you want to do is you want to change your diet in a way and how you drink to avoid contact with the piercings. They don't like to be bumped. Sometimes the straw is the best option. Sometimes people will have discomfort from the sucking. So kind of experiment and see what works best for you. You must practice cross-contamination to eliminate the possibility of infection. Meaning, wash your hands before you handle it. No oral contact, deep mouth kissing, or sexual contact for a minimum of 8 weeks or until the piercing is healed. Keep your environment clean. Clothing, bedding, towels. Do not submerge the piercing in bodies of water you cannot control the quality of, which is everything but your own clean bathtub. If you can get a body of water, if you can get in a body of water and move around and swim and it's deep enough to submerge your whole body, it's going to be full of microorganisms. You have an open wound, actually 2 of them on your face. Chances are a microorganism can get into those and cause an infection. Keep pets away from it. Don't let them sleep in the bed with you, especially those smaller animals like to sleep by your face and steal your breath while you're sleeping and are attracted to shiny objects. Keep your utensils, plates, etc. clean on a regular basis. Do not share food items and utensils with other people. Already mentioned this, but avoid playing with the piercing. Spinning it, catching it, talking a lot. If you can get this done on a 3-day weekend and you have a couple days where you don't have to talk a lot or do anything, that's probably going to be for the best. Do not use whitening products. Whitening products, some of the chemicals in that can cause issues in healing piercings, prolonged healing, etc. No whitening products, no whitening toothpaste, no the whitening gels, strips, etc. until the piercings are healed. Avoid trauma and contact with the piercing. Listen to your body. If it hurts to do something, don't do it. Downsizing. You're going to be downsizing roughly about, like I said earlier, 6 to 8 weeks, so a shorter post. Sooner if the jewelry is getting caught on a regular basis. I highly advise that when you downsize, you see your piercer and have them do it for you because they have methods and tools that are going to make it a lot smoother and not cause problems, including not be able to get the jewelry back in. Normal reactions, first 3 to 5 days, you'll see redness, discolorization, heat, tenderness of touch, inflammation, off and on for about 3 to 5 days. With oral piercings, especially those done with labret studs, it's not uncommon to see this kind of yellowish stringy stuff that hangs off of the jewelry. That is lymph discharge or discharge that your body would normally produce and harden on the outside. And the inside of your mouth, it's going to form a nasty-looking snot. Leave it alone. It'll come off on its own when you rinse. It's also not uncommon to see a white ring of tissue form around the jewelry on the inside of your mouth. That is scar tissue. Scar tissue in your mouth is usually opaque or white. It's also not common to see nesting. Nesting is where that disc will kind of make an indentation into the tissue. The only time you need to be concerned about this is if it seems like it's starting to engulf the jewelry. If it's getting to the point where it's coming over the sides, see your piercer. You may need to adjust the jewelry length or the width of the disc to make sure that it doesn't completely grow over. Now let's move on to jewelry. Jewelry should be left in at all times, only taken out to replace. You generate tissue so rapidly inside your mouth, it is not uncommon to have a piercing for years, take them out for a couple hours, and have problems getting them back in. Always wear jewelry or a glass retainer of some type in oral piercings. With threaded ends, they should be checked on a regular basis. I usually suggest pick a day of the week, and that is ball checking day. Put it in your calendar, make it a task, so you never forget. They can come unscrewed on their own. Now, if you have threadless jewelry, just occasionally making sure they're in there tight is more than enough. Avoid ends with sharp points or edges when initially healing out a piercing. Even after that, they can be a pain in the ass to have. Anything that's going to catch on clothing, bedding, towels, etc., will, in fact, catch on clothing, bedding, and etc. If jewelry is loose-fitting, it should be downsized to something that fits a little bit tighter, especially if you're having a lot of sliding or it's pressing against your upper gums, that disc in the back. Downsizing is an important process in the healing process, and sometimes it needs to be done in stages depending on how you're healing. So see your piercer for the right size. There's no universal size for everything. Now we'll move on to living with the piercing. Of course, I already mentioned this. Check the balls on a regular basis. Doesn't matter how long you've had the piercing. If for some reason or another, sometimes they just come unscrewed on their own. You're either doing this all night or what have you. Who knows, but they will. And it sucks because often you don't have a replacement end on hand, and it's this process of trying to keep the jewelry in long enough to get to the piercer to get a new end. And that can be stressful. Or you can lose the piercing because you can't, the jewelry falls out. So always check the ends at least once a week. Continue to avoid stress or contact with the piercing. If you're doing something and suddenly you're encountering pain and the piercing has been there for 2 years, stop doing that. Piercings are acceptable to danger or damage even after they're healed. Of course, you're going to need to leave that jewelry in at all times or wear retainers or the piercing will close. When switching partners, practice safe sex the way you're supposed to, which means some type of latex barrier during oral sex. You have, as I mentioned earlier, this is metal jewelry through soft tissue. There's a possibility of causing tears, even a healed piercing, so just be safe. Sometimes plaque will build up on the jewelry on the inside, on that disc and the post and etc. Brushing it or cleaning it with a plaques rinse or what have you can help to reduce that. There are some people, especially in, usually in frenum piercings in your mouth, for example, smileys, frownies, and tongue webbing, will usually have issues when that plaque builds up. It can happen in other piercings too, that it just agitates it. So it's not a bad idea to clean them on a regular basis. Just brush them off. If you can, remove them for a few minutes to do it, or use a dental. Denture cleaner can work too. Just keep an eye on them. You can feel it with your tongue whether or not there's a bunch of crap on there. And to close things out, abandoning the piercing. If the piercings are healthy, if there's no signs of infection or other problem, either during the healing process or after, removing the jewelry is not going to cause an issue. What will happen is your body will constrict the piercing and close it and then slowly fill it in. The longer the piercing's been there, the more scarring you're going to see. If you decide during the healing process to take them out, you're probably not going to see a lot of scarring. But if you've had it for a couple of years, it's probably going to look like it's still open. Now, if there is problems with the piercing, like there's signs of infection or other problems, consult your doctor or a piercer before removing the jewelry, especially a healing piercing. If you remove the jewelry and it is in fact infected, there's always a possibility that the two holes will kind of seal up, trapping the infected tissue and fluids deep inside the piercing, which means that you're going to need medical treatment probably to have that corrected. Even in a healed piercing, that's a possibility, but it's a little bit lower. Just if there's a problem, see your piercer first, ask their advice, or ask your doctor before removing. One final thing with abandoned piercings, the scarring can last for a long period of time with these. They're just the way it is. You can try anti-scarring oils and so forth. I've never had a client that really had much success with that, to be honest with you. Especially once the piercing holes are established, they're kind of there. The other thing is sebum. Sebum is a oil that your body produces. It lubricates your hair follicles, and it helps to make you waterproof. It tends to collect a lot around scar tissue and crevices. It's that thing that when you stick your finger in your navel and you haven't cleaned it in a couple of weeks, it smells really bad. That's that stuff. And with piercings, even abandoned ones, it'll sometimes collect inside the piercing. And when you squeeze it, I don't know why you're squeezing an abandoned piercing, this stuff will come out. It doesn't mean it's infected. There's no problem or what have you. You can clean it with warm water and soap. There's no reason to be squeezing it, and there's no reason to be concerned about it. It's just a normal thing. Nothing to worry about. So, do you have these piercings? Do you have angel bite piercings or beauty mark piercings? Did I miss something? Is there something you can add to the conversation? Or you have a question? Please leave a comment. Till next time, here's hoping all your piercings heal with ease and without a single issue. And if you're in the Des Moines, Iowa area, I would love to see you for your body piercing needs in the future. Have a good day, everybody. Take care, and we'll see you in that next video.